Welcome to your deep dive. Today, we're diving deep into, well, a blood test, actually. You might have even seen it on your own results. It's called red blood cell distribution with,
RDW for short, thankfully, because you sent in a mountain of research on it.
right? I have to admit, we were both pretty surprised, weren't we? I mean, the sheer volume of stuff on RDW.
It's definitely getting a lot of attention these days.
Totally.
Yeah.
And it's not just about iron deficiency anymore, which is what I don't know, always thought of when I saw RDW. You included studies linking it too, like heart disease, cognitive decline.
It's true. RDW is popping up in some pretty unexpected places, which is why we're doing a deep dive on it. And the amount of research really suggests this little measurement. It might be a bigger deal than a lot of us realize.
Yeah.
So maybe we should start with the basics, for anyone listening who hasn't spent their time memorizing blood test results. What ISRDW, really?
Yeah, I'll admit,
Mm.
even my understanding could use a little refresher.
Sure. Basically, RDW looks at how much your red blood cells vary in size. So a higher RDW means there's a wider range of sizes floating around in there. Some tiny ones, well, let's just say some more robust ones.
Okay, so it's not just about the cells being bigger or smaller overall. It's about how different they are from each other, like how uniform the population is.
Exactly. That's a great way to put it. Imagine, picture a classroom. In a low RDW classroom, all the students are, roughly the same height.
Okay, yeah.
But in a high RDW classroom, you've got some kids who are really tall, some who are average, and some who are, well, quite a bit shorter. Lots of variation.
I like that. Much easier to visualize. So high RDW, more diversity in the red blood cell world. But why should we care? That's the thing, right? Where does this whole mortality link come in?
Yeah, so that's where things get really interesting. Researchers are finding that a higher RDW is correlated with, well, a higher risk of death. And not just from one specific thing, but from all causes.
Whoa, hold on. So you're saying this one number, this RDW, could give us a clue about how long someone might live. That's kind of intense.
It's not a crystal ball, obviously, but more like, I guess more like an early warning system, you could say.
Okay, I'm intrigued. Keep going.
For example, there was this study published in the Canadian Medical Association Journal. They found that people with higher RDW were statistically more likely to die during the study period. And get this was even after they adjusted for all the usual suspects, age, smoking, if they had other health conditions.
So even if you're relatively healthy, a higher RDW could be a sign that something's off, like a red flag.
Exactly. And the thing is, this link between RDW and mortality, it's not just in one or two studies. We're seeing this pattern consistently across different groups of people, across all sorts of health conditions. It's really quite striking.
Like what kind of groups? Give me an example.
Sure. Take hemodialysis patients, for example. So these are folks with kidney failure who need dialysis to filter their blood. Medically speaking, they're already dealing with a lot, right?
Right, makes sense.
But even within that group, the ones with higher RDW, they tend to die sooner than those with lower RDW. It's like this added layer of, well, prediction almost.
So it's not just that they're already facing serious stuff, the RDW adds another level on top of that.
Exactly. And we see the same kind of thing with elderly patients. There was this study, let me see, published in the Journal of the American Geriatric Society, and they found that for older patients in the hospital, even a tiny increase in RDW, like a 1% jump, it was linked to worse outcomes. Longer hospital stays, more likely to be readmitted after they were discharged, and sadly, more likely to die as well.
Wow, that's wild. I mean, a 1% change doesn't sound like a lot, but I guess when we're talking about, an older population, even small variations can be
Significant.
Yeah, exactly. Significant. So we've talked about hemodialysis in the elderly, but what about other groups? You mentioned earlier there were studies on RDW and like all sorts of things. Heart problems are.
Oh, yeah, absolutely. Heart health is a huge area of RDW research, in fact. There was this one study, let me see, it was in the Journal of the American College of Cardiology. They looked at patients with acute heart failure and the ones with higher RDW when they were admitted. Way higher risk of dying within the next year.
Wow.
And important point, this was even after accounting for other risk factors. So it's not just that they were already sick.
Right. The RDW was adding like extra information on top of that.
Exactly. It's like, imagine you're a cardiologist, right? A patient might seem stable at first glance, but then you see that RDW and it's like this little whisper saying, hey, pay attention. There might be more to this.
I like that. The RDW is whispering. So are there other examples with the heart stuff?
Tons. I mean, coronary artery disease, for one. There was a study, this one was in Circulation, I think, and they found that RDW could actually predict how severe the blockage was in the coronary arteries.
Seriously.
Yeah. And get this, even in people without any symptoms. So they weren't even showing signs of a problem, but the RDW was picking up on something.
That's kind of wild.
Yeah.
So we've gone from RDW being this simple thing, like, oh, you might need iron, to potentially predicting how bad someone's heart disease is.
Pretty much. And it doesn't stop at the heart either. Another area where it's showing a lot of promise is predicting how severe acute pancreatitis will be. There's this really cool study where they combined RDW with the patient's calcium level.
Okay.
And that combo, just those two things, it actually did a better job at predicting the severity than the traditional scoring systems they use, which is, pretty impressive.
Wait, so a simple blood test, just looking at two things, beat out the established methods. That's a big deal.
It is, and it kind of highlights how RDW could change the game, How we diagnose and manage all these different diseases, it could be a real game changer.
Okay, so I'm seeing the pattern. Higher RDW, generally worse outcomes.
Yeah.
But what's the connection? Like, what's actually happening in the body to make this one blood marker so informative about everything else?
That is the million-dollar question. And honestly, it's something researchers are still trying to figure out completely. But there's more and more agreement that inflammation is a key part of it.
Inflammation, huh? Makes sense.
Yeah.
It seems like that's at the root of, like, everything these days.
Right. And RDW seems super sensitive to it, to changes in the body's inflammatory state. Think of it this way. When your body's stressed out, right, doesn't matter if it's from an infection, a chronic disease, even just lifestyle stuff, bad diet, not enough sleep.
Yeah.
Your body kicks off this inflammatory response.
Okay.
And that inflammation, it can actually mess with your bone marrow, which is where red blood cells are made.
Yeah.
So it disrupts how they're made, and you end up with this wider variation in size, higher RDW.
Ah, okay. So it's not that high RDW itself is causing the problems. It's more like it's a sign of this underlying inflammation that's probably doing a lot of other damage at the same time.
Exactly. It's like RDW is that canary in the coal mine, tells you there's something funky going on, but not necessarily what exactly is causing it.
This is fascinating. But I got to admit, I'm starting to feel a little overwhelmed. Haha. It's like RDW is this huge puzzle, and we're just starting to see how the pieces fit.
I feel you. It's a lot to take in, for sure. But honestly, we don't need all the answers right this second. The important thing is we're starting to ask the right questions. And the more research that's done, the clearer it'll become,
That's a good point. Okay, so we've talked a lot about RDW and, like, if you die from something.
Mortality, yeah.
Right, mortality. But what about connections to other health stuff? We touched on heart disease, but you mentioned earlier it might be linked to things like cognitive decline, even cancer.
Oh, yeah. And this is where things get even more interesting, honestly. Let's start with the cognitive decline part. There was this study published in Neurology, and they found that people with higher RDW, they tended to experience faster cognitive decline over time.
So, like, their brains were, I don't know, aging faster or something like that?
Kinda, yeah. And this was even after they adjusted for other things that affect that, like age, education, how healthy their heart was.
So you're saying this blood test, it could give us clues about someone's risk of, like, dementia, Alzheimer's, all that.
That's what the research is suggesting, yeah. Of course, more studies are always needed, but it's definitely something to keep an eye on. Now, cancer, that's a whole other thing.
Okay, hit me with it.
So there's been a bunch of studies looking at RDW and different types of cancer, and the results are honestly pretty wild.
Like, what kind of wild are we talking?
Well, there's one that found that breast cancer patients with higher RDW, when they were diagnosed, they tended to have more aggressive tumors. And they were more likely to have the cancer come back, too.
Ugh, that's scary. Is that just breast cancer, or?
Nope, similar findings for other types, too. Gastric cancer, colorectal, even lung cancer. There are studies showing similar links between RDW and how well people do.
So it's not just a fluke. There's definitely a pattern here with RDW and cancer.
Yeah.
But why? What's the link?
That's the million-dollar question again. We don't know for sure yet, but there are some theories. One idea is that inflammation, which we know is usually high in cancer patients anyway, it might be driving both things. So the tumor grows, inflammation goes up, RDW goes up.
So the RDW is like a side effect almost. It's not causing the cancer. It's just there because of the cancer?
It could be, yeah. Another theory is that RDW might be showing us changes in what they call the tumor microenvironment.
Tumor microenvironment. That sounds complicated. What is that?
So basically, it's the area around the tumor, right? And it's this whole complex system of cells and molecules that can either help or hurt the tumor. And some researchers think that a higher RDW, it might be a sign that the environment around that tumor is, well, not good, like it's helping the tumor grow and spread.
So it's like RDW is giving us a peek behind the curtain, seeing this whole hidden world inside the tumor that could, I don't know, help doctors figure out how to treat it better.
Exactly. It's all about making those connections, right? The simple blood test and then these super complex things happening way down at the cellular level. But, we should be careful not to get ahead of ourselves. RDW, it's not like a diagnosis, right? It's not like you get your RDW checked and suddenly, oh, I have cancer or
Yeah.
whatever.
Right. More like another clue, a piece of the puzzle, but you need the whole picture.
Exactly. Like solving a mystery, One clue by itself, maybe it doesn't tell you much, but you start putting them all together and then boom, things become a lot clearer.
Love that analogy. So, okay, someone's listening to us. They're like, whoa, RDW is amazing. I need to get mine checked right now. What should they do?
First things first, talk to your doctor. Always the best first step, They can order the test, and more importantly, they can explain what your results mean. Everyone's different, everyone's got their own health history, so context is key.
Always good to have those conversations with a professional who, actually knows your situation. But it's got to feel good to go in there, like, prepared, right? Being able to have a real conversation about your own health.
Absolutely. That's what I think is so cool about this kind of research, honestly. It empowers people, gives them the information they need to really be in the driver's seat with their own health.
Love it. So as we're wrapping up this deep dive on RDW, what do you think? What does the future hold for this little blood test? It feels like we're just getting started, doesn't it?
Oh, totally. We've just scratched the surface, in my opinion. Think about it. As we get more data, especially long-term data, like how RDW changes over time in the same person, not just comparing different groups, that's where things get really powerful.
Yeah, I see that. But
Yeah.
what can we do with it? What are we talking big picture?
Imagine like totally personalized healthcare, right? We could use RDW along with other things, maybe some other biomarkers, your lifestyle, all that, and we could tell who's at risk for certain conditions before they even have symptoms.
Whoa. So instead of waiting for something to go wrong, we could be like one step ahead.
Exactly. Preventative medicine, taking action before you get sick, not just reacting after the fact. That's the dream, right?
That's amazing. And I'm guessing RDW could be helpful for other stuff too, like research, right?
Oh, absolutely. Drug development, understanding aging better. The possibilities are huge.
Yeah.
It's crazy to think that this one little blood test, something that's been around forever, it might hold the key to all sorts of breakthroughs.
What a journey this has been. Okay, that is a wrap on our deep dive into the world of RDW. To everyone listening, thank you for coming along on this ride with us. This was a fun one. Hopefully you learned something new, maybe even got a little inspired to, I don't know, be a little more curious about your own health.
Knowledge is power, right? The more you know, the better decisions you can make. So keep learning. Don't be afraid to ask your doctor questions. And just, yeah, stay curious.
Couldn't have said it better myself.